So today we will talk about pharynx. So basically, pharynx already discussed in respiratory system. Here also some introduction part is given. The oropharynx. So we have three areas where pharynx is there. Oropharynx. This whole area is pharynx. Nasopharynx, oropharynx, laryngopharynx. Naso near the nasal. Okay. Oro near the oral cavity. Near the larynx. So each whole area is known as pharynx. Okay. This is the thing we have to remember. The food, oropharynx and laryngopharynx. So oropharynx, this is the oro, naso. Naso from the nasal cavity. Oro and laryngo. This is the food passage area. This is the food passage area. Okay. No digestion takes place in the larynx. So here digestion will not take place. Okay, its only related function is swallowing. So what is this function? Only related function is swallowing. The mechanical movement of food. Swallowing is mechanical movement of food from mouth to stomach. So this is the oropharynx, laryngopharynx. When the bolus of food is pushed back on the tongue, the constrictor muscles of the pharynx contract as a part of swallowing reflex. The reflex center for swallowing is the medulla, which coordinates the many actions that take place. Constriction of the pharynx, cessation of breathing, elevation of the soft palate to block the nasopharynx, elevation of larynx, and closure of the epiglottis and peristalsis of the esophagus. So everything, whatever during the swallowing, we have number of functions. Okay, we have to stop the breathing, pharynx will constrict, okay, and soft palate will be, it will be go upward, elevated, okay, and the food cannot enter into the nose, larynx will be elevated, and epiglottis will close. So all these functions will controlled at medulla oblongata, small brain. Okay, so swelling is also a very good, very important process. Okay, this much physical physiology is there for the function of swelling. So this is done by medulla, and as well as peristaltic movement of esophagus will be constrict and relax, constrict and relax. Then only food will enter into the stomach. But because it's reflex, we don't have to think about happening correctly. Talking or laughing while eating, however, may interfere with the reflex and cause food to go into the wrong pipe, the larynx. When that happens, the cough reflex is usually effective clearing the way. So sometimes while we are eating, we will talk very much. We will talk. And second thing is that uh, 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 and second thing is that while talking, we're using something. So that time the food will enter into the wrong pipe, not in esophagus. It will be enter into the air pipe or larynx. So what will happen at that time? The cough reflex will happen to remove the thing. Okay, this is the function of pharynx. Okay, so that much complicated is swallowing, but due to the medulla oblongata, the work is very easily done. Okay, so understood pharynx. So next is esophagus. So we have esophagus. You can see that this is the esophagus. The long line is esophagus. Esophagus is a muscular tube. So how it is made up of? It is made up of muscle, which takes food from pharynx to stomach. Here also no digestion take place, only peristalsis. Means here The expandation, constriction, likewise. Okay, like I will peristaltic movement is like that. Okay, will happen because food will enter into the stomach. Food in one direction, only it will go. It will not come outside. Okay. Ensure that food gets into the stomach even if the body is horizontal or upside down. At the junction with the stomach, the lumen cavity of the esophagus is surrounded by lower esophagus sphincter or cardiac sphincter, a circular smooth muscle. The lower esophagus sphincter relaxes to permit food to enter the stomach when contracts to prevent the backup of stomach contents. If the LES does not close completely, gastric juice may splash up into the esophagus. This is painful condition we call heartburn or GERD, gastroesophageal reflux disease. Most people experience heartburn once in a while and is merely uncomfortable, but chronic GERD is more serious. The lining of the esophagus cannot withstand the corrosive action of gastric acid and will be damaged, perhaps resulting in bleeding or even perforation. Medications are available to treat this condition. So here, esophagus will allow the food in one way. It will cannot taken back. Okay, and at the ender of esophagus, this is the esophagus ending point. This is the esophagus, and this is the ending point. So here we have the sphincter, LED or something, LES, lower esophageal reflex or lower esophageal sphincter or cardiac sphincter. LES is the lower esophageal sphincter. Sphincter means the closure. The, the door will only open for going the food inside the stomach, not it will come outside. But sometimes there is a gastric juice in this stomach which will digest the food. But sometime what will happen, the gastric juice will come outside the stomach. So here the gastric juice only it is permitted in the stomach only, but it is coming outside, it will damage the lining of esophagus, esophagus or mucosa. So that condition is known as GERD, gastroesophageal reflux disease. So what will cause it will cause severe burning sensation. The patient complains severe pain. I have burning pain. I have that also then second name is epigastric pain. Okay, okay. At that time, antacids will give it in the hospitals. But here, the most common cause is overeating, eating of spicy food, not eating on the time. So these are the common causes of GERD. So understood about esophagus, pharynx. So the upper cavity, over oral cavity, we talked about mouth, we talked about teeth, we talked about tongue, we talked about pharynx, we talked about esophagus. Now, what is stress? And we will talk about layers. So here from that we have layers because with that only the digestion and ingestion and absorption will happen. Here they are not helping to digest the food. They are helping to reach the food on the digestion area. So in the digestion area, we have the lining. Okay, what are the lining and how it is made up of? We will talk here. So we have four layers. How many layers? Four layers. Mucosa. Next is submucosa, external muscular layer, and serosa. So first layer is mucosa, submucosa, muscular layer, and serosa. It is from inside. If it is stomach, okay. From here, if it in four layers, This is mucus. This is mucus. This is muscular layer. This is serosa. If you come out from outside, serosa, muscular layer, submucous, mucosa, mucosa, submucosa, muscular layer, serosa. So these are the four layers which will help for the digestion also, indigestion also, ingestion also, absorption also. So the four layers are presented from the beginning of the stomach to the ending of the large intestine. Okay, so let's talk about what are there in these layers. Okay, before we continue with our discussion of the organs of digestion, we will first examine the typical structure of alimentary tube when viewed in cross section. Okay, we'll cut with cross section. If it cutted, it will see like that. Okay, we have four layers: mucosa, submucosa, external muscular layer, and serosa. Each layer has a specific structure and function. So there's the reason we have to study it. Okay, first layer is mucosa. First layer is mucosa. Let's talk about mucosa. The mucosa or lining of alimentary tube is made up of epithelial tissue, areolar connective tissue, and two thin layers of smooth muscle. Okay, so mucosa have three different types of things. One is epithelial tissue, areolar connective tissue, and two smooth muscle tissue. In the esophagus, the epithelium is stratified squamous epithelium. In the stomach and intestine is simple columnar epithelium. The epithelium secretes mucus, which lubricate the passage of food. So here we have the esophagus, we have epithelium cells. In the intestine also epithelium cells. Because it is stratified, in the esophagus stratified. Here columnar, in the shape of the cells. Okay, column-like substance, column-like cells. Okay, so what epithelium do? Wherever epithelium is there, you have to remember that it will release the mucus to make substance lubricant, to make substance lubricant, to pass the food easily. Okay, and also secretes the digestive enzymes of stomach and small intestine and other functions. They are given to the epithelium cells, epithelial tissues, because they are the cells. In that tissue have cells, which is important for the digestive, because they secrete the digestive enzymes. So okay, in the stomach, we have epithelial tissue. First thing we have to remember. And second thing we have to remember, the digestive enzymes are released by this epithelial tissue. Okay, in the mucosal layer. Okay, just below the epithelium within the alveolar connective tissue are lymph nodes that contain lymphocyte to produce antibodies and macrophages to phagocytic bacteria or other foreign material that get through the epithelium. The thin layer of smooth muscle create folds in the mucosa and ripples so that all of the epithelial cells are in touch with the content of the organ. In the stomach and small tissues important absorption. So here we have epithelium. Below the epithelium, we have other tissue, that is areolar connective tissue. So what they do? They have lymphocytes, they have macrophages, they have phagocytic action. Okay, to kill the bacteria because the food enter into the stomach. Okay. If the second layer is the first layer is the for the digestive enzymes. Second layer is for attacking any harmful substance present in the food. Okay, that's the reason second tissue is given as defensive tissue. Okay, so here we talked about mucosa. Mucosa have two types of tissue: epithelial tissue and areolar tissue. Epithelial tissue do two things. One is release mucosa. You can have digestive enzymes. Second tissue, that is areolar connective tissue, which have defensive mechanism. These two things you have to remember. Next, come to the submucosa. Submucosa is made up of areolar connective tissue with many blood vessels. Blood vessels and lymphatic vessels. Many millions of nerve fibers also present. Is called enteric nervous system, brain of the gut. which extend the entire length of the alimentary tube. The nerve networks in the submucosa are called mesenteric plexus, and they innervate the mucosa to regulate secretions. Parasympathetic impulse increases secretions wherever sympathetic impulse decreases secretions. Sensory neurons are also present in the smooth muscle. Motor neurons to blood vessels to regulate vessel diameter and blood flow. So basically, submucosa have three things: blood, lymph, and nerve. Because from that area, we will get the nourishment, nutritions, oxygen, everything, and control of brain from that area only. So that's the reason we will call enteric nervous system, brain of the gut. So from that area only, the brain nerves are attached to everything. From that area, it will go to the brain, parasympathetic and sympathetic. So basically, whenever secretions needed, okay, it will go through parasympathetic. So we have to stop the secretions, it will go to the sympathetic. Okay, so these are the things we have to remember from that submucosa. Mucosa have digestive enzymes and defense mechanism. Submucosa have supply, nerve supply, blood supply, lymph supply. Next, we have external muscle layer. External muscle layer. So very, very important. For peristalsis movement, we need muscle support. The external muscle layer typically contains two layers of smooth muscle. So they have two types of layers, inner and outer. Inner is circular and outer is longitudinal. Length. Okay, we'll see here. You can see that these are the longitudinal muscles, these are the circular muscles. One again oblique muscles are the opposite. Okay, so we have two types of muscle layers, circular and longitudinal. Variation for the typical to occur. However, in the esophagus, these layers is stratigized muscles in the upper third, which gradually changes to smooth muscles in the lower portion. The stomach has three layers of smooth muscles rather than two. Okay, contraction of the muscle layer help break up food and mix it with digestive food. So it will contract. Contraction will make the juices, the food, all those things to mix up very. Sometimes we notice that our stomach will move. What happened? Is there anything happen in my body? Okay, because that is a smooth muscle. That is the muscles of stomach which move, which done peristalsis to mix the food with the juices. Okay, next we have aerobax plexus. This is also the area which have number of neurons. Okay, nerve supply. So that is the reason stomach problem can create headache to the patient. So because the connection is direct to the brain. Okay, so is the problem in the digestion, problem in the gastritis, problem flatulence, uh, constipation, all these problems will affect the brain. So that is the reason every doctor is advised to the patient that he have to clear his gut. He had clear motions. Digestion is very perfect. Okay. Sympathetic impulse decrease contraction and peristalsis, whereas parasympathetic impulse increase contraction and peristalsis. So this is the functioning of the brain. Okay. So which give the this movement, the nerve is 10th cranial nerve, also called vagus nerve. Yesterday we talked about tongue. Here we have the muscular layer have 10th cranial nerve. It is vagus nerve. So because of the irritation, okay, what will happen? The patient will get the irritation in the brain, irritation in the stomach, it have vomiting sensation. This is also a reflex. Next we have serosa, last layer of the organs of the alimentary tube. Okay, not all organs, only stomach and esophagus, and we have small intestine, large intestine. Above the diaphragm of the esophagus, the sero is almost outermost layer in fibrous connective tissue. So which tissue is made up of fibrous connective tissue? Below the diaphragm, the serosa is the mesenteric or visceral peritoneum, is serous membrane lining the abdominal cavity in the parietal peritoneum, usually simply called peritoneum. The peritoneum mesentery is the actual one continuous membrane. The serous fluid between the peritoneum mesentery prevent friction when the alimentary tube contracts and the organs slide against one another. So how serosa also have two layers. You can simply tell them that peritoneal, okay, and mesentery. So these are the fluid is there which will prevent friction. So the movement of the muscle, the movement of the serous, mucosa, submucosa, muscular, all this will help. Serosa will help them, okay, to decrease the intensity, to increase the intensity, to there is no friction. So all this will help. So these layers are very, very important. You can go through this diagram. You can see this parietal peritoneum is there here, okay, and diaphragm is there, okay. So we have that all those things. So you have to remember that mucosa, submucosa, muscular, and serosa. Mucosa have two things. One is mucus, and second thing digestive enzymes. And other thing is defense mechanism. Submucosa have supply blood, vessel, and nerve. Muscular have peristaltic movements and bunch of nerve supply. Okay, okay, bunch of nerve supply. That is aerobax plexus, and another we have serosa, which help for to the all these layers. Okay. Next, how we have to study stomach. So we will discuss tomorrow about stomach in detail. Stomach, small intestine. Next, we have small intestine, liver, gallbladder, pancreas, and in the absorption of small intestine, absorption how it happens in large intestine is there. Okay, we will discuss all those things in coming classes. So any doubt you can ask.